This video is on testicular torsion. Testicular torsion is a medical emergency because it can result in the loss of the affected testicle if not diagnosed and treated in a timely manner. Consequently, it is a must-exclude diagnosis in any male, but especially in kids. The hallmark of testicular torsion is acute, severe scrotal pain. Physical examination will demonstrate a swollen, tender scrotum with an elevated testicle. The risk factors to consider are intrinsic, medical, and lifestyle related. Intrinsic risk factors are newborns, pubertal males, family history, and a bell clapper deformity. A bell clapper deformity is when the attachment between the tunica vaginalis and testicle is inappropriately high, resulting in a shifted axis and hence increased mobility, predisposing to torsion. Medical risk factors include a past history of torsion and a history of undescended testes. Lifestyle factors include trauma to the area. Let's look at the pathophysiology in greater detail. Testicular torsion is when the spermatic cord twists due to inadequate fixation of the testes to the tunica vaginalis, as shown in this diagram, and we can also see the contents of the spermatic cord in the diagram. So as the spermatic cord twists, it compromises the arterial supply to the testicle, as well as compressing the pampiform plexus in the spermatic cord. This leads to ischemia and infarction and ultimately potentially hemorrhagic necrosis. The testicle is particularly susceptible because its entire vascular supply is in the spermatic cord and there is no collateral supply. As it is an emergency, diagnosis is based on clinical findings and the patient should be taken for surgical exploration to confirm torsion and for treatment. If the clinical presentation is, however, equivocal, a Doppler ultrasound may be performed. Treatment requires surgery detorsion, and if the testicle is undescended, such as in a newborn, orchodopexy is needed, so moving the testicle into the scrotum, descending the testicle. If torsion has been ongoing for over 6 or some say 12 hours, the testicle may need to be removed, so an orchiectomy. Don't forget supportive measures such as keeping the patient nil by mouth and clear fluids in preparation for surgery, as well as appropriate analgesia. Thank you for watching. If you learned something, please tell a friend who may also find it useful.